How can you tell a tear versus a strain? The biggest one is going to be noticeable loss of strength, even if the pain isn't limiting that so much. The body does some stuff where it'll actually decrease your strength due to trying to preserve itself. So if you are injured, even without a tear, you may be weaker because of the way the brain's kind of gating that strength output. But this will be a pretty obvious greater than 50% weakness in that motion. So the supraspinatus being the way to lift your arm away from your body. If you're suddenly lifting half the weight on a shoulder abduction or something like that, that may be a factor. We're going to order some imaging. That's what we're really going to tell about this one. Popping sounds may or may not go along with this in terms of the diagnostic utility here, figuring out if that actually was a tear versus a strain. But either way, unless you're a high-performing athlete, something like that, even if you have a tear, we're probably going to treat it very similar to a sprain and adjust the plan based on your pain and your recovery rate and those sorts of things. So it doesn't really matter quite as much if we know tear versus a strain.